Welcome to video 2 in the EKG Detective series. This month we're going to be looking at sinus arrhythmia. The EKG Detective is dedicated to helping healthcare professionals make the transition from using inductive EKG interpretation skills to deductive EKG interpretation skills. If you're interested in finding out the differences between the two, I would encourage you to go back to the first video where we spent a little bit of time talking about the differences between the two. But for this series, I am going to follow Sherlock Holmes's lead and tell you that once you use EKG deduction, it becomes elementary in the aspect that it is much easier to wield and utilize when you're trying to interpret what an ECG rhythm is. Throughout this entire series, we are going to use two job aids. The first job aid is the EKG Detective Interpretation Checklist. The nice thing about this checklist is it really helps illustrate the mechanics of how deduction works. And if you're interested, just reach out to me at relevanceineducation.com and let me know that you would like a copy of the checklist, and I will make sure that I email one out to you so that you can use that as we go throughout this series. The second job aid that we are going to be using throughout this entire series is the EKG Detective phone app. It is available at the Apple Store and the Google Play Store. All you need to do is keyword search EKG Detective, and it will take you to where you can download a copy of the app. It's something that's not required, but it is a little bit easier to use in the aspect that it will more directly walk you through the process of deduction than the checklist will, but you by no means need to have a copy downloaded to work through this series. So the biggest question to ask is who can benefit from using EKG Detective? And the answer to that is anybody who is struggling with an ECG interpretation. The nice thing about this process is it allows you to focus on the waveforms and the things that you can see in the ECG, and you don't have to spend as much time focusing on the criteria within an ECG. So let's jump into this dysrhythmia and work through the criteria associated with the sinus arrhythmia and illustrate how the deductive process will get us to this interpretation. So after you open the app and get past the disclaimer page, the app is going to ask you if the rhythm is regular or irregular. Looking at this rhythm, it is an irregular rhythm because we have quite a bit of variation between the R to R intervals. So we will go to the app, select irregular, and then we'll hit next to go to the next screen. Referring to our checklist, since we know the rhythm is irregular, we can deductively eliminate any of the rhythm options that are regular. And as a side note, anybody who is interested and would like a copy of this checklist, just reach out to me and I will make sure that you get a copy of it so that you can utilize it for future reference in future videos. Question 2 is going to ask us if the irregularity is possibly caused by PACs, PJCs, or PVCs. So let's go ahead and take a look again at the criteria for these fundamental ectopic beats. PAC is going to be a beat that's going to have a different looking P wave from the underlying rhythm, but the PR interval is going to be normal between 0.12 to 0.20 seconds. A PJC is going to be a beat that is either missing P waves, or if there is a P wave in front of the QRS, it is generally going to be inverted and retrograde, and the PR interval is going to be short at less than 0.12 seconds. And then a PVC is going to be a beat that has a totally different looking QRS complex in comparison to the underlying rhythm. So when we apply these criteria to all these beats within this ECG, it doesn't appear like we have PACs, PJCs, or PVCs. So we will go to the app, we will select no, and then we'll hit next to go to the next screen. Going back to our checklist, since we have no PACs, PJCs, or PVCs, we can deductively eliminate those off of our checklist. The third question is going to ask us if there are identifiable QRS complexes. Looking at this rhythm, we definitely have QRS complexes that are identifiable and distinguishable. So we will go to our app and we will select yes, and then we will hit next to go to the next screen. On our EKG checklist, since we do have identifiable QRS complexes, we can automatically eliminate ventricular fibrillation because that rhythm does not have definable QRS complexes. Question 4 brings us to whether there is irregularity possibly caused by pauses. Now, this can be a pretty confusing area of criteria, so let's go ahead and revisit what constitutes a pause and what does not constitute a pause. Okay, so looking at this ECG, it appears like there might be a pause between this flashing bracket. So to make that determination, what we would need to do is we want to measure the R to R intervals before and after this gap. And as we look at these intervals, it doesn't appear like there's any consistent intervaling. And when we actually measure the intervals, there is no consistent R to R intervaling before or after this gap. So since there isn't consistent intervaling, this is not a pause. It's just a larger gap within a rhythm that is basically irregular. Looking at this example, we do have a larger gap, so it does appear like there may be a pause. But what we need to do is we want to measure the R to R intervals before and after this gap. And when we measure those intervals, we do have consistent intervaling between the R to R intervals before as well as after this gap. So since they are consistently intervaled, this is a pause and it is not a gap. So to reiterate, what we need to look for to have an actual pause is consistent R to R intervaling before and after the gap. And if that is the case, then we do have a pause. Since we've determined that there is not a pause, we will go to our app, we will select no, and then we'll hit next to go to the next screen. Going back to our checklist, since there is not a pause, we can eliminate two rhythms, which are sinus arrest and exit block, because those rhythms are associated with pauses. Question 5 is asking, are there P waves that appear to be sawtooth and or flutter waves? And looking at this ECG, it doesn't appear like we have any extra P waves or flutter waves in this rhythm. So we will go to our app, we will select no, and then we'll hit next to go to the next screen. Looking at our checklist, since we don't have flutter waves, that allows us to get rid of atrial flutter because flutter is associated with flutter waves or F waves. Question 6 is asking if we have discernible P waves. Looking at these P waves, they appear to be very discernible and right in front of the QRS. So we will go to our app, we will select yes for discernible P waves, then we'll hit next to go to the next screen. Back to our checklist, since we do have discernible P waves, that allows us to be able to get rid of atrial fibrillation because AFib has non-discernible Ps. Question 7 is asking, are there 3 or more different shaped P waves? Looking back at our P waves, it appears like they are all pretty similarly shaped. There definitely is not any different morphology. So there's not different shaped P waves. We will go to our app, select no, and then we will hit next. Looking at our checklist, since we do not have 3 or more different P waves, that will allow us to get rid of wandering atrial pacemaker. Question 8 is asking us if there are extra P waves or if there's more than one P wave for every QRS. And looking at our P waves, they are definitely there, but it doesn't appear like we have extra P waves. So we will go to our app and we will select no, and then we will hit next to go to the next screen. For those working through the checklist, Since there are no extra P waves, that allows us to get rid of the two rhythms on our list that are associated with extra P waves, which are secondary type 1s and secondary type 2s. Question 9 is asking, what is the PR interval? So when we look at these PR intervals, we are running somewhere between about 0.16 to 0.18 seconds. So we will go over to our app and we are going to select 0.12 to 0.20 seconds. Then we will hit next to go to the next screen. So referring back to our checklist one last time, since we have a PR interval of 0.12 to 0.20 seconds, that means we can get rid of a sinus arrhythmia with the first degree heart block, because with the first degree heart block, we would have a prolonged PR interval. And that leaves us exclusively with the sinus arrhythmia, which is no surprise since that's the topic that we are talking about today. And that's where this checklist will take us. And for those who are using the EKG Detective app, it would obviously lead us to a sinus arrhythmia because that's the dysrhythmia and the topic of discussion for this video today. My inclination has been to stay away from addressing the clinical aspect of these ECG interpretations, but I am going to make a little bit of an exception for this specific rhythm and talk a little bit about what it means clinically. So if you look at this dysrhythmia in relation to bracketing, it appears like the rate is decreasing, or basically it's going fast to slow and then going to fast again. And that tends to be a pretty common thing with sinus arrhythmias. The reason for that is normal breathing patterns. So when the patient is inspiring, it is relatively common for the rate to actually increase. And during expiration, the rate tends to decrease. And then in inspiration, the rate tends to increase. The reason for that is because of our vagus nerve. And when you are exhaling, there is increased interthoracic pressure that puts stimulation or pressure on the vagus nerve. And the vagus nerve's responsibility is basically to slow down the heart rate and vasodilate blood vessels because it believes that the blood pressure is acutely spiking. And then during inspiration, there is negative pressure in the thoracic chest cavity, and the vagus nerve is not being stimulated, and it is actually being decreased. And this is a normal occurrence. When you have somebody who has a sinus arrhythmia, you want to associate it with inspiration and expiration. And if that is the case, that is referred to as a respiratory sinus arrhythmia or an RSA. And what respiratory sinus arrhythmia is in the presence of a healthy individual, it is a strong clinical indicator that that individual has a very healthy, functional, and strong heart. So if you have somebody who has a sinus arrhythmia that's not associated with the respiratory pattern, or it's actually backwards, or they have a history of significant cardiac disease, then you need to start thinking a little bit more deeply in relation to this sinus arrhythmia may not be normal. But in most cases, if it's a young, healthy person and they have a sinus arrhythmia, all of the clinical research up to this point in time pretty much indicates that it is an indication of a really strong and healthy heart. All right, that brings us to the end of this month's video on sinus arrhythmia. And again, I'd like to reiterate, if anybody would like to get a copy of the EKG Detective Interpretation Checklist, or you have any questions or comments about the phone app, don't hesitate to reach out to me at relevanceineducation.com. I will make sure that I try to answer your questions, or I get you the resources that you ultimately need to work throughout this series. And the one thing that I would appreciate is if you would subscribe to this channel. Since it is a relatively new channel, it would just help it out immensely as we're getting this up and running. And most importantly, I want you guys to remember that it is always better to practice as a clinician rather than a technician. And we will see you guys next month.